Today we are pleased to be joined by Professor Rosa Maria Bruno, a physician, a researcher, and a professor in Université Cité, and in the hypertension and pharmacology unit at Hôpital Européen Georges Pompidou à Paris. Welcome, Professor Rosa Maria Bruno.
Thank you.
So before we begin, could you please tell us briefly about your research and clinical interests?
So, as you said, I'm a medical doctor, I'm a hypertension specialist, and my main focus for clinical research is the study of vascular aging, and in particular, development of new devices to measure vascular aging non-invasively, but also testing the existing devices for their clinical use in randomized clinical trials and fostering their use in clinical practice.
Okay, perfect. So with vascular aging, we usually talk about arterial stiffness. So why has arterial stiffness become such an important topic nowadays, and why is it often underlooked?
So I think you raised a $1 million question, so it's not easy to answer. So the arterial stiffness is one of the way we can measure vascular aging. The vascular aging process can be represented by atherosclerosis, the formation of plaques, but also by arteriosclerosis, which is the stiffening of the large arteries. And what is appealing in arterial stiffness measurement and research is that it can be measured non-invasively, it can be measured very easily with the operator-independent technique, and it can be really scalable in every clinical setting and even outside the clinical setting, I would say. So there is really a big potential of having these measures repeated over time and really be integrated in the clinical pathways.
And why is early vascular aging still difficult to identify nowadays?
So honestly, for a long time there was a problem of definition of what does it mean early vascular aging. So intuitively it's easy because you say, okay, one person is old as long like his arteries. So it's you can say something like this, and everybody will understand that a man is as old as his arteries. But in reality, how we can define it require a lot of background research to be sure to give the right label to the right pattern, and then this must correspond to a difference in terms of clinical management of the individuals. And we did a lot of work on arterial stiffness in this case because there are large epidemiological studies that have used this technique, and so we were indeed able to define which individuals has arteries that are younger than their chronological age, and despite exposure to classical risk factors, and the individuals in which the arteries are really older, and even without the presence of cardiovascular risk factors, because the two things, what we consider cardiovascular risk in terms of classical scores, what we use with age, blood pressure, cholesterol, and sex. Sometimes it is different to what really happens at the level of the arteries. The same factors may have a completely different impact on the health of our arteries.
Perfect. And when we usually talk about vascular aging, we usually talk also about pulse wave velocity. So what added value does the pulse wave velocity bring to the table beyond the traditional measurements?
So the big advantage of pulse wave velocity is that you can assess arterial stiffness and vascular aging very easily in a reproducible way, in an operator-independent way, and it really helps identifying those individuals that are at risk of cardiovascular events, even if their usual measurements that we do with blood pressure, with cholesterol, are perfectly normal. So these individuals, now we know that if they have targeted preventive strategies, so if we treat them on time, we can really prevent cardiovascular diseases. And so this is really important and has a lot of impact, especially for young people, because these are young people are the group of patients that are always neglected in cardiovascular prevention, because we always think that cardiovascular disease is something for the old, while it's true that if we manage to change the trajectory of vascular aging in young age, we have an enormous potential of improving cardiovascular health in the long term. Because here in the young age is when really preventive strategies are effective, not just trying to make some adjustment when it's too late. So this is why I like a lot to do preventive medicine and use novel devices to improve and find the right persons, because we don't want everybody to be considered as sick when he's young. We want just to identify the person at risks.
Perfect. And so you talked about cardiovascular prevention. So what role does integrated diagnostic play in the preventive cardiovascular care?
I think it will play a bigger and bigger role, because when we talk about cardiovascular prevention, by definition, we are talking about a multidimensional problem, because there are different ways in which our cardiocirculatory system may be damaged. So it may be damaged by diabetes, by cholesterol, it can be damaged by factors that we don't know, lot of unknown factor, environmental factor, bad nutrition, inactivity, and the impact can be identified at different levels. So we can have problems at the heart, so we may need an ECG or some heart test to diagnose that there's a problem there. We can, at the same time, measure blood pressure and pressure waveforms and pulse velocity, have an idea what's happening in the arteries. So having all these things together is really the basics of cardiovascular prevention.
Perfect. Thank you very much for sharing your insights and for your time. It was really a pleasure talking with you.
Thank you.